Hi guys, Sarah from Inspired Physiotherapy here. Today we're going to talk about low back pain, and something that me, Chris and Deb always see is this sort of posture where you sort of tilt your pelvis forward and it kind of jams up your lower back. And it's very common in sort of pregnant women, or if you've got a bit of a bigger stomach, or even with some dancers we see, it's really a nasty posture. And so when you have that posture, your core in your front, or your deep core, the one that really stabilizes your spine, is actually quite weak and it's not able to turn on in that position. So one of the quickest ways that I can get you out of that painful position is just to turn your deep core muscles on and tilt your pelvis back the other way. So it's almost like you're tucking your bottom underneath. And you can practice that in standing, you can practice it in sitting, or you can even practice it lying down. But it's really important that you learn to engage your deep core so that you get your back out of that position. Okay, so to follow on from my previous video, if you're feeling really confused as to how to actually activate your deep core, I'm going to show you how to do that now. So I find the easiest way when I have a patient in is to get them lying down with their head on the pillow and their knees bent, and I'll walk you through the steps. So I'll do that now. So the first thing I always make sure they do is that you breathe normally. So a lot of the time I get patients and they hold their breath, and that will actually inhibit you from activating your deep core. So what I would say is get 2 fingers, feel for your hip bones, and then come into the squishy bit. And then what I want you to imagine doing is that you're pulling the band of muscle below your belly button down into the bed. And I'll do that for you now. And I feel that muscle get quite tight where my fingers are. And then you should be able to hold that contraction while breathing and talking. If you're holding your breath or you're having trouble talking, you're not able to hold that independently. And then just let it go, and then try that again. So it's a really light contraction, but again, you should feel it with your fingers, and that's why I always say to palpate there. If you're having a lot of trouble with that and you feel like you're just not getting it, I recommend coming in, because it's a really good and important exercise to help with managing your low back pain.